Hi, my name is Stephanie Burcusa. I'm a licensed psychologist here in outpatient behavioral health at Benefis Health System. What are some questions that you might want to ask your provider about behavioral health? So one of the first things that comes to my mind is a lot of people question, is this normal to feel this way, or is this behavior normal? And so I think that can be a great place to start. So if you have concerns about how you're feeling or about something that you're doing, for example, if you're feeling depressed or anxious, or you need to drink in order to fall asleep, or you're worried that substances might be getting in the way, or anything like that, if you have concerns about something, I always think it's a great idea to bring it up with your provider. It's better to ask than not. Sometimes people are hesitant to bring it up because they worry that, gosh, people are going to think I'm crazy, or they worry about judgment from their provider, or they worry that if by even saying something that they're going to get locked up against their will or something like that. That's very, 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 very rare. So for the most part, it's just better to bring it up and to ask. Most providers have heard everything under the sun already, and so there's very little you could say that would really surprise your provider at this point. So if you're concerned about something, bring it up and ask. And then if you and your provider decide that it's something that you might want to get help for, a second question that you could ask is, well, what are my treatment options? Sometimes people think that it's really just medications or nothing, but really there's a whole range of options that you could have for treatment. So it could be anything from self-help. Your provider might be able to guide you to some books or some resources in the community, things like that. Or maybe you do therapy, group therapy, individual therapy. Maybe you do medications. Maybe it's some combination of all of those things. Maybe it's a higher level of care, like a residential treatment or something like that. There's a whole host of options out there, and your provider can help get you squared away with the option that feels like the best fit for you, that's going to be most likely to help you. Then, and as part of that, another question might be, how long does treatment take? And unfortunately, this one's a lot harder to answer. So if you're going the medication route, it usually takes 6 to 8 weeks for medications really to take full effect. For most things, like for depression and anxiety, some medications do work a lot faster than that. Therapy, maybe just a couple sessions will be enough. Maybe therapy would take a few months. Again, it really is variable from person to person. But if you ask your doctor what kind of course you're looking at, your doctor can help you to figure out what that course of treatment might look like and how long it might take for you. And then finally, I think another question that you might want to ask your provider is, what do you do if it's a crisis? So maybe you're doing okay now, but you wonder, what should I do if things get worse? Having a plan ahead of time and working that out with your provider is a really great option. So I think we all know the emergency department is there for us if we're in a crisis, but maybe there's some other steps to do along the way. Maybe there's some things that you could plan for yourself that, hey, I'll try this and this, and then if that doesn't work, then I'll reach out to this person, and if that doesn't work, then I'll go to the emergency department at that point. And so having a few options and having that mapped out ahead of time can be really helpful to know what to do if that crisis is happening. So in the mental health world, we call that a safety plan. So having a plan for what you're going to do so you know what a crisis looks like for you and you know what your options are, up to and including the emergency department if that becomes necessary. Another thing that's kind of newer and maybe not as well known as it could be is a psychiatric advance directive. So just like we do advanced directives for our medical health, and so we can plan ahead for what we would want at potential end of life, we can do a psychiatric advance directive too. So if we're unable to make decisions for ourselves because of a mental health or a substance use condition, we can make a psychiatric advance directive so we can say, these are what my wishes would be, and these are the people who I would want to help make those decisions for me if I can't do it for myself. So having a plan for if a crisis does come up in the future is a great thing to talk about with your provider as well.